Screening for colorectal cancer. Take it away. We are talking right now about a very important subject. It's colorectal cancer. It's the #3 leading cause of death for both men and women in the United States. And so it's very important that we talk all about it, learn the signs and symptoms, and know how we can prevent it. So talking with me now is Dr. Lee, a Premier Surgical Associate of Colorectal Cancer Surgeon at Premier Surgical at Fort Sanders. So thank you so much for joining me today.
Oh, thank you for inviting me.
Of course. So you are the expert here. We want to know all about it. So let's talk about who is at risk for colorectal cancer.
The patients who are at risk for colorectal cancer is the personal history of colon polyps or rectal polyps, or the family members with a colorectal cancer, or if you have an inflammatory bowel disease such as Crohn's disease or ulcerative colitis, you're at higher risk for the colorectal cancer.
Right. And if you are maybe at higher risk or not, and you still are someone that is affected, what are some of the risk factors to look out for?
With only colorectal cancer, most times they actually do not produce any symptoms. That's why the screening is a key to detect these cancers early. But if they do, there are some symptoms that you need to look out for are change in bowel habits, change in your stool calibers, such as a thinning over stools, or bloating stool, or unintentional weight loss, or unexplainable abdominal pain are things that you can look out for.
Right. You did mention that this is somewhat of a silent killer because early detection is important, but a lot of people don't really realize that they are maybe someone that has come down with this if they have not been detected. So let's also talk a little bit about who should be screened and what age.
In 2018, with us new data showing the increased risk of colon cancer in younger patients under 50, the American Society of Colon and Rectal Surgery changed our recommendation to consider studying screening at age 45 if you're an average risk adult.
Do you think it's appropriate or needed if someone is younger that might be experiencing some of these symptoms to go ahead and get screened as well?
Yes. So if you have any type of symptoms as I discussed earlier, the recommendation changes. So if you have any symptoms, you can get a colonoscopy to see if you have any issues in your bowel.
Right, and a lot of people probably say that getting a colonoscopy is probably not the funnest experience. So what would you say to encourage people to go out and get regularly screened?
So as a colorectal surgeon and treating the colorectal cancer, I see every day the suffering of the patients who have waited too long to discover their disease. And the patients who benefit so much from doing a regular screening and then get detected early and get treated for it and get cured. So it is not fun to undergo colonoscopy or a screening test, but it is also really not fun to deal with a cancer. So I recommend getting the screening done if you can.
Yes, cancer is much worse, and we spoke to somebody about Wear Blue Day. We just came down from that, and about colon cancer awareness, and we really push that. Yes, colonoscopies are not fun, but cancer is not that much either, so it's definitely good to be preventative. Where can people find more information about you and everything you spoke about today?
You can find more information at premiersurgical.com, and of course you can Google it, and also there's a website from the American College of Colorectal Surgery that you can find more information on too.
Thank you so much, Dr. Lee. Remember, all this information, it's very good information, very helpful for all ages, can be found on livingeasttennessee.com. Thanks so much, Dr. Lee. Up next, we head back in to talk to our Maker of the Week, Nephew Furniture, and take a closer look at non-toxic, locally